Welcome to this video on surgical airway, the final frontier in crisis resource management. We begin with the concept of the failed airway. Remember, when you can't intubate and you can't oxygenate, or CICO, stop struggling with the glottis and move to the neck. Identifying anatomical landmarks is the most critical step. Utilize the laryngeal handshake to quickly locate the thyroid cartilage, cricothyroid membrane, and cricoid cartilage. Essential equipment should be simplified to reduce cognitive load. A standard kit includes a number 10 scalpel blade, a pre-lubricated Frova bougie, a 6.0 mm cuffed ETT, and a 10 cc syringe with a securement device. Indications for a surgical airway fall into categories like anatomical trauma, pathological obstructions such as angioedema, technical failures like CICO, and external foreign body obstructions. The preferred modern approach in emergency medicine is the scalpel finger bougie technique. This involves a vertical skin incision, a horizontal membrane stab, finger dilation, and then passing the bougie followed by the ETT. The target time to ventilation is roughly 45 seconds in trained hands using the scalpel bougie technique. A clinical pearl: once the decision is made, execute immediately. Do not wait for complete desaturation. For pediatric considerations, in children under 8 to 12 years old, standard surgical cricothyrotomy is contraindicated. The alternative is needle cricothyrotomy using a 14G or 16G catheter and jet ventilation. Potential complications include hemorrhage, where prioritizing the airway over bleeding control is key, misplacement, which requires EtCO2 confirmation, and barotrauma, particularly with jet ventilation. Confirmation is achieved visually and with quantitative waveform capnography. For security, use sutures or specialized neck straps. Post-op, obtain an immediate chest X-ray to confirm tube depth. In summary, predict the difficulty, prepare the neck, and don't hesitate to cut when necessary. As noted, the only thing worse than a patient needing a surgical airway is a patient who needs one and doesn't get one. Thank you. Please see my contact information on the screen. These are the image sources used in this video.